Hi, this is Dr. Sean Flynn. Did you know that lumbar spinal stenosis affects people mostly over the age of 50? Stenosis is a narrowing of the spinal canal, and it occurs due to mostly natural age-related changes, such as arthritis of the spine, where you are getting some of the bone spurs around the joint. The disc, as it starts to thin, can tend to bulge into the spinal canal, and there's also ligaments that run up and down the spinal canal that, as we age, tend to thicken, and this creates a narrowing and squeezing of the nerves that are in the spinal canal. So symptoms of spinal stenosis are usually leg-based pain. So you'll have pain or numbness, tingling in the legs, sometimes weakness. A lot of times people will say that their legs feel heavy, and the positions that are going to irritate this the most will be standing, especially standing stationary. And walking can also be irritating, especially as you start to walk longer and longer distances. You may even notice if you're in the store and you have a cart and you lean forward on the cart, that relieves your pain. Because when you do that, it opens up the spinal canal and actually creates space in there. Because the changes that occur in the spine with lumbar stenosis are permanent, this is a condition that is manageable, not curable. But with treatment, you can have pain relief and you can improve your function and even your walking duration. So what does spinal stenosis look like on an image? Here we're going to go over an image and you can see what it looks like. This is what stenosis looks like on an MRI. If we compare the space between the orange lines with the space between the green lines, these lines are marking the border of the spinal canal. And you can see the space between the green lines is narrowed compared to the space between the orange lines. And it's narrowed because we have a disc herniation at the tip of this yellow arrow here, and the red triangles are showing thickening of the ligament. So between the ligamentous thickening and the disc herniation, it creates a narrowed, squeezed space in the spinal canal. These are the types of treatment we do in office to help you get relief from lumbar spinal stenosis. Because stenosis causes narrowing of the spine, we want an adjustment that not only restores motion to the joints, but also creates space. And that adjustment would be flexion distraction. Flexion distraction has been shown in studies to actually increase the canal space by up to 28%. So it restores motion and creates that space that we're looking for with stenosis. So the adjustment looks like this. And this is always done within a patient's pain tolerance. And we can add in some distraction on the table as well to create more space. And we can bring the table side to side to open up different areas of the joint. And as needed, we could go to each level of the spine and treat that. An additional treatment we can do for stenosis is the automated distraction here, where we use a strap for the back and on the ankles. And this is only if this is tolerable for the patient. And we can distract all the way up to 2.5 inches, and there'll be a hold at the end, so it's pulling that spine apart and holding for a few seconds and then coming back together. And that's just another treatment that can help relieve the pain of stenosis.